just wrapping things up, I did want to ask, there's a new class of drugs called CELMoDs, and I was hoping that you could shed some light on what that means. So much alphabet soup going on.
No, absolutely. So, CELMoDs are the last iteration of drugs that interact with a protein called cereblon and belong to the pathway of drugs such as, originally thalidomide, lenalidomide, and pomalidomide that have been tried against multiple myeloma. Iberdomide is a great example of this drug. They're small molecules. They come in the oral form. They're pills. And there's a couple of things we've learned. First, you can use much lower doses because through medicinal chemistry, people have learned how to better match this to the target protein. So you need less of a drug. More importantly, they can sometimes overcome resistance in patients who have failed to respond previously to things like, Revlimid and Pomalyst, et cetera. So it's a very exciting line of work. And, the data from early clinical trials is very promising. So I would anticipate that they're going to be part of our toolkit to treat multiple myeloma. And by the way, I forgot to mention, and since you asked me about other compounds, another one that's coming very fast to us is Venetoclax. And Venetoclax is a drug that is approved for other leukemias, but we have used that in myeloma, particularly in myeloma patients who have a specific genetic abnormality. That is patients who have a translocation between chromosomes 11 and 14. This is an abnormal fusion. For patients who hear this, this is something that your doctors would know about it. It's in the pathology report. It's not genetics that are present in the rest of your body, nothing that you inherit or pass on through generations, but it's something that happened in those myeloma cells. And Venetoclax has proven to be quite effective in this patient population. So even more options there as well, too.
Preventative vaccines, I know that was something that some people had been asking about in terms of preventing the smoldering myeloma from becoming active. Where are we with those studies?
I hear rumors we're going to hear more and more results about successful outcomes with vaccination. And it's very interesting because I mentioned before, 15 years ago, immunotherapies were just, for the lack of a better word, it's just not respected or the laughing stock in the cancer community because, oh, here you come again with this result and it's not effective. It's not the right patient population. It turns out now immunology is the hottest thing in cancer therapeutics. And so vaccine specialists will not fall behind. I think they can work in many settings. They can work in smoldering. Potentially, they could work in post-transplant MRD situations. And if we learn how to harness the immune system, that would remain, again, one of the most powerful tools we have for the treatment of myeloma and every other cancer. I know there's at least 3 that I can think of that are under development. And again, just excited to hear about positive results with that. Hopefully no vaccine hesitancy, right, as we talk about vaccinations for things like myeloma.
Well, hopefully COVID has helped with that conversation as well. My last question, Dr. Fonseca, is what is your last message to patients and caregivers? We've gone over so much in terms of what's being studied, what's on the horizon. What can they think of in terms of the different options and where we're headed for in terms of myeloma treatment?
Yeah, thank you. Trust your team, but I recommend all patients at some point, and this is not self-serving, that they engage with the Myeloma Center of Excellence so they can participate in the planning of their treatment or at crucial moments. There are centers all across the country, so you can work with one of them. I always tell patients, it's better if I didn't meet you here. It's better if we met socially, but we're here, and just know that there are options and there's significant room for hope and optimism as we think about the future of myeloma. If I see a patient who's newly diagnosed today, there's a pretty good chance that that person has a median survival that will exceed a decade, 10 years, with the best available treatment. And I always tell them, how I will treat myeloma 10 years from now, I just simply don't know. And some of the patients that are relapsing now, who were treated with therapies of 10 years ago, who perhaps were not on maintenance, it's almost as if they started anew. And that is just because the treatments that give them the control not only are valuable for the control they give, but also for the options that they open into the future.
Again, thank you so much, Dr. Rafael Fonseca, Executive Director of the Mayo Clinic at large. We really appreciate your time today.
Thank you very much, Stephanie, and I look forward to talking to you again in the future.
Oh, absolutely. And so for everyone who wants to check out Dr. Fonseca's interview, always head to thepatientstory.com, where we give human answers to your cancer questions.